Well, great news to share with you this morning. The number of premature births are declining in New Mexico. The March of Dimes recently released new data that showed that the premature birth rate has gone down. Dr. Abraham Lickmacher, Chief of Women's Services at Loveless Health System, is here to talk with us about this and why this is so significant to our community. Doctor, thank you so much for dropping by. So this is positive. The March of Dimes has this premature birth report card that they come out with. And I guess in the year 2012, we actually got a better score.
We did, yes, and that is a great improvement. Obviously, premature births are a problem. You know, for most pregnancies, they tend to go well and it's not a problem, but for about 12% of those babies tend to want to come out a little bit earlier than we want them to come out.
Yeah, and you mentioned the 12% because I think their report card that they came out with said 11.5%, basically 12% of all premature births here in New Mexico. That's the percentage.
Yes.
Yeah.
And the good news is that New Mexico, we've been improving for about the last 6 years, similar to what the rest of the country is. Unfortunately, we still only gathered a grade C on the report card, which means we're about the same grade as the rest of the country. So we need to keep improving. And
no doubt, it's a difficult time for parents, for families who know or who have to, for whatever reason, have a baby early. And I know when I got pregnant both times, I always had in the back of my head this fear of, oh my goodness, what if something happens? And you know, you always think about birth defects too. But doctor, I was surprised to learn that there are some things women can do to reduce the risk of birth defects. Can you talk to us about that?
Yes, actually one of the most easiest things to do is to take folic acid, which is a vitamin supplement that you can pretty much get in all foods and you can get it in any vitamin store. And the important factor with that is to begin it before you actually even know that you're pregnant. So it's a good idea to get on folic acid when you're planning a pregnancy.
Like when you plan it.
Yes.
I heard that maintaining a healthy weight too during your pregnancy is also very important for that, regarding this.
Absolutely. The biggest advice that we give patients is to plan things out. Get it in the best shape you can. Get yourself into a good diet, a good routine, good exercise routine, and most importantly, if you have bad habits, particularly smoking, which is a real big no-no, stop smoking. And that is one of the factors that contributes to premature deliveries.
Wow, this is all great information because you always hear about the folic acid. You would think that the smoking is common sense, but unfortunately, we have seen that oftentimes it is not. For whatever reason, some women continue to smoke. And lastly, I wanted to ask you, there was recently a grant that is going to be awarded to the March of Dimes to actually help educate women about reducing the risks and all that. Can you tell us about that?
Yes, actually, the Kellogg Foundation and March of Dimes and other organizations, philanthropic organizations, are contributing funds to help educate patients, to help them educate about the folic acid supplementation, getting in to see their doctor early, and also about maintaining good health habits, and particularly cigarette smoking. Part of what we do is reliant on how the patient comes to us. Yeah. And I think getting that message out to the patient is extremely important.
Thank you so much for this useful information, Dr. Lickmacher, for coming in and chatting with us this morning. Thanks a bunch.
My pleasure. Thank you.
Time right now.